welcome back to this episode of the Hormone Café. Today, we're going to talk about gut health. Gut health is so important because when we think about our fertility and we think about our hormone balance, all of our nutrition comes from our food, and your gut is what breaks it down into the essential elements. So our fats, our amino acids, our short-chain fatty acids from our fiber, all gets broken down in our gut and then reabsorbed into our bloodstream. And those are the building blocks that our body uses to make hormones. And when we think about inflammatory diseases, Hashimoto's, PCOS, there is such a huge relationship between those disorders and your gut health. So today we're going to talk about what is a healthy gut, how do you test your gut, what are the gut health treatment options, and then a sample patient that I had. So what is a healthy gut? This is my vision for you. I need you to be pooping 1 to 2 times per day. So you should never go a day without pooping, and I don't want you to be pooping 7 or 8 times in a day. So you want to be pooping once or twice a day, a nice, soft bowel movement. You don't want it to be too hard. You don't want it to be like rabbit turds. You don't have to sit on the toilet and strain. And you also don't want to be having diarrhea. You don't want to be having such loose stools that it doesn't have any formation. And you want your stool to be homogeneous, meaning you don't want it to be a lot of undigested food that you can see in your stool. You want it to be the same color, the same consistency, one soft lock. I know that sounds really gross, but I talk to my patients about their gut health and how they're pooping all the time because it's so essential to your health. And it's sometimes things that we just don't talk about because who wants to talk about to their girlfriends how they pooped today over a cup of coffee? Not exactly top of mind for everybody. The other thing is that I want to make sure you don't have any blood in your stool. So your stool should never be black, brown, or bright red bleeding. And then you should also never have bloating or gas pain. Sometimes we associate that with PMS and we get bloated or gassy around the time of our period or around the time in that luteal phase before we have our period. You should never ever feel bloated or gassy or have abdominal pain. So you should have a nice soft poop every single day and you should never feel bloated or gassy. If you have that, we need to test your gut to see what's going on with your gut. So how do you test your gut? The best way is to do a poop test, which is completely gross. A poop test is really, really gross. But you can mail a kit to your house, you poop in these tubes, you mail it back into the lab, and it gives us this whole comprehensive report so we can really make a personalized action plan for your gut. Things that it tests, for example, are how well are you at digesting food? How well are you absorbing food? Do you have any gut inflammation? What is your gut microbiome profile? And then do you have any infections? So overgrowth in bacteria, overgrowth in parasites are things that I see all the time. So all of those things we really need to be fixing so that you have a nice soft form bowel movement and your gut feels amazing every single day. Number 1, so that you feel excellent every day. And number 2, so that you're really absorbing and processing the nutrition that you need in order to make hormones in proper amounts. Other tests that we do that are related to your gut health, we can do blood work for inflammatory markers, so sometimes that's needed. And then we also do a SIBO test, or small intestinal bacterial overgrowth. That's actually a breath test. So if we're worried that you might have SIBO, you have just a ton of bloating and a ton of gas, we'll often have you do a SIBO test. And then another thing that we do is food sensitivity testing. And we can do more of a basic or more of an advanced food sensitivity test. And that is a blood test where we can test for up to 120 different foods or chemicals that you might be sensitive to. And then we make a whole really specific protocol. So for people who have done various elimination diets, or you've done Whole30, or you cut out gluten and then you cut out dairy and then you cut out soy, it seems very random and not very specific. Oftentimes we'll do Whole30 and then we might feel great or not great, and then we just go right back to our old eating. It didn't actually give us anything actionable that we can use to take forward to the future. So if we do food sensitivity testing on you, we can make a really specific protocol. So we'll say, okay, day 1 through 7, you eat these specific foods. Day 7 through 14, we eat these specific foods. And it's a lot of maintenance because we have you keep a really detailed food and symptom journey. But at the end of it, you're empowered with all of these tools that we can use, number one, to just heal your gut. And number two, so that you know what you can and can't eat to help you feel great every single day and poop every single day. So when we look at our different gut health treatment options, in the kind of different categories of things that we see, one is that we see a lot of times people have really significant problems with their digestion and they just do not digest food properly. I had a patient who had a really, really low hormone profile and her ovulation quality was very, very poor. And we checked lots of different things. And when we did her gut health test, we saw that her pancreas was not working properly and she was not digesting her food properly. So I had to give her prescription digestive enzymes. She started taking them. She felt amazing. And you could see in 1 month, her ovulation improved drastically. So by just being able to resorb and digest her food properly, now she had those proper building blocks so her body could make hormones and she could finally ovulate properly. So one big thing that we'll often do is check your digestion. How well are you digesting food? Do you need to take over-the-counter digestive enzymes? Do we need to give you prescription digestive enzymes? Because oftentimes we all know that there's sometimes foods that just don't sit well. Whether that's broccoli, raw carrots, cruciferous vegetables, meat, going out to eat. If you ever have that feeling like, ooh, that's kind of sitting in my stomach, you really want to make sure you're digesting that food properly. And then we want to make sure you're absorbing the food properly. So in people who have a leaky gut or they have poor absorption issues or they have an inflamed gut, we want to do that food sensitivity testing. And then we want to specify really specific supplements so that we can heal that leaky gut. IgG is a big one. For example, oftentimes we'll use IgG for people who have leaky gut, which can cause a lot of bloating symptoms to heal some of that leakiness. And then parasites and infections is something that I see all the time. I have a patient who went on a mission trip. She caught a parasite. She had it for years. She had no idea that she had it. We had to do multiple rounds of parasite treatment. She finally was able to get pregnant once we got her gut fixed. But it required a lot of testing and a lot of treatment because sometimes parasites can be really resistant. But the great thing is that they're treatable and they're testable and you can really clean your gut out so that it feels so much better. So parasites is a big one that I see. And then oftentimes I'll see just a big overgrowth of severe gut infections. Oftentimes we think of things like E. coli and salmonella, but there can be lots of other bacteria that can be massively overgrown in your gut. And those can be treated either with antibiotics. Sometimes it is such a significant bad overgrowth that we need to give an antibiotic to really kill it off, or we can do herbal antimicrobials. So some of the herbal things that we use are something called uva ursi, berberine, oregano, and the great thing about a gut health test, it tells you what the bacteria are sensitive and resistant to. So for example, you might have a Citrobacter infection, and that infection can be treated with these antibiotics and these natural microbials. So we have a really specific plan of exactly how to treat that bacteria. So that is extremely important. And then when we look at inflammation in your gut, we need to figure out, okay, where is that inflammation coming from? Is it coming from food? Is it coming from infection? Because if your gut is inflamed, you are not going to feel very great at all. And then we also want to see what your gut microbiome looks like. For example, do you need to take certain probiotics or not take certain probiotics? I had a patient the other day who her gut was very, very high on lactobacillus and bifidobacteria. And when you look at 95% of the probiotics out there, they're all lactobacillus. So it's important that her gut was tested because you don't want to give her a probiotic that she already has an overgrowth of in her gut. Because if she takes a lactobacillus probiotic, it's going to be making her feel way worse because now she's going to have an overgrowth. So it's really important to look at your whole gut microbiome so you can tailor your probiotic to it and make sure you're taking the right probiotic. Whereas if you are low lactobacillus, low bifidobacteria, low Akkermansia, those are some of the probiotics that we want to supplement to grow back your healthy gut bacteria. Sometimes it's not a probiotic that we need, but it's actually a prebiotic. So another thing that gut testing can look at is our short chain fatty acids. And if we're not eating enough fiber, we're not going to have a lot of short chain fatty acids because fiber is metabolized into something called short chain fatty acids. So we want to be looking at the different sources of fiber that we're doing, and a lot of our prebiotic foods are fibrous foods. So that's going to be our grains, our vegetables, beans, and seeds. So we want to get a sense of how much fiber is getting metabolized, because fiber makes it all the way to the large intestine. So if we're not eating enough fiber, then we're not getting any food to feed the gut bacteria in our large intestine. So on our food testing, on our gut health testing, that can look really low, and we can see, oh yeah, you have no bacteria in your large intestine. If you have no bacteria in your large intestine, you're definitely going to feel bloated and gassy because you don't have any healthy bacteria to metabolize your food. And a lot of your nutrition comes from absorption in your large intestine. So you want to make sure that you have a healthy gut microbiome throughout your whole GI tract, and that you're eating in a certain way to feed the proper amounts of those specific gut bacteria that we need to be healthy. So we want to make sure you're digesting your food well, you're absorbing your food well, you don't have an infection or a parasite, and that what kind of a pre and a probiotic you need. And sometimes those can be things that we can do easily on an everyday basis, and sometimes those need to be supplements or medications that we prescribe. In general, things that will help you digest are eating a tablespoon of vinegar or apple cider vinegar every day, really focusing on our fermented or pickled foods. So pickles, pickled beets, kimchi, sauerkraut, those are just foods that can really help us digest food in general. And then we can also watch our fiber and then take probiotics or probiotic foods if needed, like yogurt, for example, things with live and active cultures. So it's really, really important to get your gut health tested so we can make a really specific profile tailored to your gut and what it needs. I had a patient who came to me, and I always talk to my patients about their poop and how they're pooping, and she only pooped every 7 to 10 days. And I said, Lisa, that is not normal. And she said, Sarah, I've literally been like that my whole life for the last 10 to 15 years. Like, I literally only poop every 7 to 10 days. And I really wanted her to do a gut health test, and she was resistant to it. And I said, we just really need to test your gut. So when it came, she would have episodes where she was so constipated that she would throw up. And that was just normal for her. She just thought that was normal. So we tested her gut, and she had a 10 out of 10 metabolic imbalance, which meant that she just was not absorbing or digesting her food properly. And then she had something called beta-glucuronidase, which was really elevated, really low short-chain fatty acids, and she had a full-blown gut infection called Enterobacter. So now we have all of these tools where we can make a plan to get her pooping every single day. So for her Enterobacter, I had to give her a specific antibiotic to treat that specific thing. So we needed to kill off this bad bacteria. And then I had her eat specific foods to help her lower her beta-glucuronidase, because beta-glucuronidase recycles estrogen back into your bloodstream. So if it's overgrown in your blood, it can contribute to significant hormone imbalances. In fact, it was giving her such high estrogen that it actually grew endometriosis, and we did endometriosis surgery on her. But I had her do apples, for example, Brussels sprouts, broccoli, cabbage, lettuce, fermented foods, and really focus on those foods that we can bring some of those abnormal proteins down into a normal level. And then I also had her, because she wasn't metabolizing protein well, for a short period of time while we healed her gut, I had her cut out meat, processed food, sugar, and alcohol so that we weren't feeding those bad bacteria and we were allowing her healthy bacteria to grow back. I started her on something called calcium D-glucarate to also help her metabolize that elevated beta-glucuronidase. And then we put her on a probiotic with lactobacillus and bifidobacteria to help reconstitute her natural gut microbiome. And then she needed to be taking way more fiber so that we could increase her short-chain fatty acids. And she wasn't naturally a person that ate a lot of fiber, but she did a smoothie every single morning, and I had her dump a ton of fiber into her smoothie. So flax seeds, chia seeds, and then I needed her to be eating a bit more vegetables and a bit more high-quality grains. And after 3 months, she was pooping every single day, and she came to me and she said, Dr. P, I had no idea how bad I was until I started pooping every single day. I feel amazing. I've never pooped this well in 10 years. She was shocked. She was so happy. Her husband was super happy. And this is a patient who had done multiple rounds of IVF, failed IVF, came to me. We fixed her bowel movements. We did endometriosis surgery on her. She had her baby. She just came to see me postpartum. I said, how are we doing? She said, I'm doing amazing. I said, how's your gut? She said, we're still pooping every single day and I feel amazing. So that is what I wish for you. Amazing bowel movement every day. No bloated or gassiness. I want you to live your life and never think about your gut so that we can be absorbing the nutrients that we need to make you feel great every single day and have a beautiful hormone profile. So if you're listening to this and you're thinking, oh yeah, I do have some gut issues. If you have a friend who's always complaining about their gut issues, they're always bloated or gassy, please send them to me. Check us out at verafertility.com. And stay tuned for our next episode where we'll be talking about hormone profiles and the different types of hormone profiles. Thank you for joining us today on this episode of the Hormone Café.